Thank you very much for the introduction. This research was done by the Department of Medical Imaging of the University of Algarve. And our title is The Quantification of Tertiary Scatter Radiation in the CT Room. Our main purpose was to evaluate the tertiary radiation because there isn't a simple method to easily estimate tertiary radiation levels for specific facilities. This is our instrumentation. Of course, we used the CT scan. We had a 25-liter water phantom because we tested mostly on the chest area, one lead shield, radiation detectors, and several TLDs, as well as a full-body anthropomorphic phantom. Our variables in the experimental phase, we had the acquisition parameters, the distance to the isocenter, the thickness and composition of the phantom. Our dependent variables are the energy and the dose rate of tertiary radiation. This is a diagram to exemplify the positioning of the patient, the CT scanner, and the doctor here for any interventional procedure. So we simulated a chest CT examination. These are our parameters. And the water phantom was placed in the CT equipment table. The detector's position was defined. As you can see, we have several angles. And we also turned the detector for 10 minutes to then subtract any background radiation to reduce the error. 6 measurements were made. You have the angles here, and I can show you here on this image. You have the CT scan, here the detector in various positions, and also up and down. We also placed a lead barrier between the phantom and the detector, and we made measurements again. Here it is, right in front of the detector, in several angles as well. In order to isolate the detector from the tertiary radiation, a cylinder lead was used. 2 measurements were made, and you can see here, one with the top protected and one without. You can see here, completely isolated except for the top, and here the top is also isolated. So after we have all this data, we proceeded to the simulation with the full-body anthropomorphic phantom. We placed several TLDs on the body, from the skull to the members. This is the results for the scatter radiation. Of course, without lead, you can see a serious drop here in the radiation, and with the lead shield, much lower radiation. Here in percentage, as you can see, for 180 degrees, much more difference in the radiation. And with and without the top and the cylinder, the protection, you can see there's a lot of difference between the two, and this is quite considerable if we take into account several exams during a full year. On the phantom, these are the areas that had the most radiation exposure, so left eye, very sensible anatomical places. And then we calculated the individual exposure for occupationally exposed individuals in a real situation for a given year. You can see here for different parameters and the doses. And here, yes, we have to take into account the tertiary radiation. So in conclusion, it only contributes with 3.6%. And of course, the major contribution of the tertiary radiation comes from the dispersion that occurs on the roof, which is very important. Usually the radiological protection measurements done by radiographers are efficient, and usually they are enough. However, given the effect of the scatter radiation, especially on the roof, we have to take into account maybe some additional measures of radiation protection, maybe some lead caps in the head or something, a similar instrument, to avoid the harmful long effects of this type of radiation. So thank you very much for your attention.